Hello, my name is Leslie Lilly, and I'm a registered nurse, and I'm working on my bachelorette degree at Bluefield State College, and this is my ethical presentation regarding life, death, and dying from ethics class. I am employed on an inpatient oncology unit, and working on an inpatient oncology unit, I commonly experience ethical issues regarding life, death, and dying. Commonly, I see families unaware of how critical their loved one's condition is, and I really truly feel as if this is the case because of a lack of education between the healthcare team and the families. One question remains on my mind every day as I'm working, and this is the question that I'm going to present to you today and examine in depth. Will educating patients and their family of end-of-life care affect the patients and their families' beliefs, response, and acceptance of impending death? The answer to this question is not merely black or white. It requires careful consideration of the pro side as well as the con side. And first, I would like to talk to you about the specifics of the issue. One of the most common controversial bioethical topics in recent years is related to withholding or withdrawing life-sustaining treatments when they are deemed to have poor outcomes or no benefit. These decisions are usually made by physicians along with careful consideration of the patient's families. These decisions may be confusing and difficult for all of those who are involved, and ethical dilemmas at the end of life commonly revolve around these issues. According to our text, technology has stretched the boundaries and clouded the waters surrounding life and death. In society, death has become an unnatural event, frequently associated with hospitals and other institutions surrounded by tubes, machinery, CPR, and heroic efforts. But often these heroic efforts don't seem to be enough, and our loved ones and our patients' families have trouble accepting this because in the end their loved one dies. Families need to be educated about the limits of modern medicine and be able to understand exactly why in some circumstances death is imminent, and aside from a miracle, modern medicine can only do so much. This is the basis for my question. Will educating patients' families on end-of-life care affect patients and their families' beliefs, responses, and acceptance of impending death? First, I would like to examine the pro side of the question. While researching for this presentation, I came across an article in the American Psychological Association's journal written by Dr. Rosenberg and Dr. Jenny Spice. In this article, there was a case study presented, and it spoke of a woman named Sheila, who was a 28-year-old African-American mother of 2 small children, and she worked full-time as an engineer and a project manager. Sheila was married to Jonathan, and Sheila had been referred to a Dr. Stevens for management of her diabetes and her depression. Well, Sheila began to take a lot better care of herself, and she began to lose weight. But eventually, Sheila lost too much weight, and she began to feel very fatigued and very just unhealthy and tired and drawn out and worn out, and her doctors had a very hard time figuring out what was going on with her. And through multiple hospital visits and multiple ICU admissions, Jonathan, her husband, remained hopeful with each new diagnosis. Sheila's husband, Jonathan, had a lot of trouble associating his wife's condition with the death of his own mother. Jonathan's father blamed the quote-unquote white doctors for the death of his mother, and it took a long time for Jonathan to get past this because he felt that they too gave up too soon on his mother. Despite his past with his mother's conditions, Jonathan remained hopeful, and as the healthcare team was helping Jonathan and Sheila, they invited her husband to be active an active team member in the decision-making process, despite the many uncertainties of his illness and then through her eventual death. Because they offered care in this way and encouraged Jonathan to be part of the decisions and part of the decision-making team, the realities of Jonathan's wife's condition was apparent to Jonathan. And this aided Jonathan in moving past the mistrust of the healthcare team so that he could be more fully present to Sheila, which in turn support her and reduced her suffering. What lesson do you think could be learned from Sheila and Jonathan? That when allowing families to participate in the decision-making process and teaching them as new developments occur, it aids the grieving process and allows the family to have a better acceptance of impending death. According to an article by Dr. Kara Breshkoff in the American Geriatric Society Journal, the key to education and the acceptance of death is advanced care planning. And this article discussed how it's important for healthcare providers to encourage communication with the patient and their family and their medical power of attorney early in their diagnosis so that advanced planning would be able to be made and the families could be able to accept the upcoming death and maybe even allow comfort measures to begin. According to the Journal of Palliative Medicine, in an article entitled Development of Supportive Care Measures for Economic Evaluation at the End of Life Using Qualitative Methods, it speaks how it's imperative for care providers to assess the resources, implications, and the meaning working with the patients as well as their families to determine where the family member would like to die and the evaluation of care strategies. When I speak of where the family member would like to die, I mean at the hospital receiving treatment or at home under palliative care. They described how to do this through 2 sets of interviews with the family and patients, in which they discussed the conceptual elements of the good death and follow-up interviews to check with the attributes to these interviews where meaningful participations and where they talked about in depth about suffering, maintaining identity, independence, choice, dignity, love and affection, being supported, and preparation for death. If these things are addressed at the time of diagnosis and if families are able to talk to their loved ones while they are coherent enough to make these conversations, the dying process is much easier because they are able to accept the wishes of their dying loved one. So that is it for the pro side of my argument. The con side of my argument is in that regardless of what we as healthcare providers teach our families of our loved ones, some families just aren't as accepting or willing to listen. Religion plays a key role in the inability of some family members to be able to accept impending death, and the ability for education to affect their beliefs, responses, and acceptance of impending death. According to the Canadian Association for Critical Care Nurses, many monotheistic religions maintain that God is the life giver and that He is the only one who can take a human life, and that if you withdraw life-sustaining treatment or refuse aggressive treatment, that it is basically breaking the thou shalt not kill commandment, and it's against their religious beliefs. Religious beliefs also can foster hope that a miracle can occur, and for many Americans this also holds true. In a survey of 1,036 members of the U.S. general public, 57% did believe that God could help heal a patient if physicians believed the patient to be futile. And also, this is true for other religions other than Christianity. Many Muslim patients believe that illness and disease may be a test from Allah, and that tidings of forgiveness and mercy may be made if they basically pray to reduce their suffering, and pray through their illness. But every individual is different, and their personal beliefs and attitudes can certainly affect whether or not a family's beliefs, responses, and acceptance of impending death can be changed with additional education by healthcare staff. We may ask, how does this affect us as nurses? Well, as nurses, we see our patients as they're dying, and this can definitely take a mental toll on us as well. And as nurses, we must be aware of our own attitudes and beliefs of living and dying, as well as beliefs of the expectations of patients, families, and other healthcare providers. Such awareness alerts us to a situation in which there are different attitudes among the parties involved. This provides us with an opportunity for us to open lines of communication before a serious dilemma arises. The nurse should always have the best interests of their patient at heart, and through education, I truly believe that we as nurses are doing our part to give families all the information that they need in order to make the choice that's right for them. And at the end of the day, even though we may not feel good about what outcome our patient had, education is one way that we as nurses can know that we did everything that we could for that family. And we don't have to feel so bad if things don't go the way that they wanted to, or if they're having a hard time accepting death, because we know that we did what we could. Often we as nurses will have the dilemma of knowing, regardless of what we do and regardless of how good of nursing care we provide, the patient's outcome is often grim, and it's important that we understand and explain to the patients and their families that even if we do get them back through CPR or mechanical ventilation or life-sustaining surgery, that their underlying condition is still there. When they get up from their CPR and when they come back from CPR, they still have stage 4 metastatic breast cancer with mets to the brain, bone, and liver, or they still have an underlying stroke that's going to seriously affect their quality of life once they come out of it. And as nurses, the best thing we can do is examine our own beliefs and educate our patients, the families, the best we can. I truly hope that you take what I say into consideration and be able to apply both the pro side and the con side to your nursing practice and be able to understand where these patients and their families are coming from. Thank you.